Hello everyone, welcome to today's session on role of pulse oximetry during COVID-19 pandemic. I hope all of you are taking care of yourself and staying healthy and fine. So today's session, we will discuss about a few basic importance of pulse oximetry or a pulse oximeter in today's pandemic condition. Now, you all are aware that coronavirus testing efforts have been continuing and it has already ramped up with a lot of usage of face masks and gloves, sanitizers, and now it has become definitely part of your regular life. But now we have got a small diagnostic tool that actually just clips onto the tip of your fingers and have become one of the most popular gadget in today's uh, practice, or you can say at a day-to-day practice also. And now that gadget is basically used to fight against the coronavirus, and that is called as a pulse oximeter. It actually painlessly checks your blood oxygen level, which can be affected by lung diseases and especially COVID-19 condition. A pulse oximeter is a small device that measures the heart rate and your blood oxygen saturation, which is called as SpO2. Okay, it is usually clipped onto your finger, but can be attached to your ear, nose, toe, and forehead. But then some of them are battery operated and provide real-time results on a small LED display, which is there on the device itself. There are other devices also which connect with a wire to a separate, you can say, a vital sign monitor, but that is basically in hospital-based pulse oximetry, and it is basically used to record all your heart rhythm, your temperature, your BP, your blood pressure, and using other sensors of your body. If someone has a reliable pulse oximeter at home and they know how to adequately use it, it can be beneficial for some people at this pandemic situation. So having a normal oxygen level can be reassuring, although there is no guarantee that someone won't have a fast decline with their breathing status. So it's quite possible that someone has a normal oxygen level and can quickly progress to a very low oxygen level. Sometimes that can be a life-threatening condition too. So the normal pulse oximeter oxygen level, what you see reading is basically from 95% to 100%. And anything less than 90% is something where you are alarmed. It's considered to be low. And if patient with COVID-19 has SpO2 less than 90%, you have to refer to a further evaluation to the medical examination or possible treatment options. A low oxygen reading by itself is not enough to actually diagnose only COVID-19, but your doctor would want to know about it, especially if you notice the level decreasing over time. And if you have been diagnosed with COVID-19, your doctor may want you to monitor the oxygen level, whether it is declining, worsening, becoming better, and the readings have to be noted down. So if someone with COVID-19 has symptoms, the most common symptom besides fever and cough is shortness of breath. Most, but not all the people with COVID-19 pneumonia have shortness of breath. That is something which has to be noticed. Most, but not all the people who have low oxygen levels have shortness of breath. There are some people with COVID-19 who do not necessarily feel shortness of breath despite they have pneumonia. So there is a lot of, I can say, uh, confusion in understanding whether you really have the issue with your oxygen saturation, because you may have SOB, but you may not have the shortness of breath, the saturation level falling down. So it is always understandable that does it really mean that you should run out to a hospital or run out to buy a pulse oximeter? Yes. The oxygen reading that are obtained through pulse oximeter are definitely genuine, may not be 100% sensitive and specific, but then mostly better than the apps. Nowadays, there are a lot of apps which are coming up on smartphone, which are not accurate enough to depend upon the clinical use. So even though pulse oximeters are not perfect, but still much more accurate compared to your smartphone apps. The oximeters are always used in hospitals and sometimes used at home for people who have underlying health conditions, especially lung conditions. It could be a COPD, chronic bronchitis, emphysema, and so many other lung conditions which are possible. The purpose of the pulse oximeter for most of the people is best served when someone is feeling ill and they are deciding on whether or should not go to hospital. Keep in mind that there are conditions that may cause falsely low readings of pulse oximeter, such as A dark nail polish, artificial nails, nails too long that affect the placement of the pulse oximeter. Cold hands, poor circulation, patient having high cholesterol or high lipids into the blood circulation are also most important reasons why there are more chances of false reading with the pulse oximeter. So this shows you the various parts of the oximeter. You have got one button operation. We have to just click it off. You have the above reading, which shows you the pulse rate. Then you have got an SpO2 oxygen saturation level. You have a display screen, what you can see. You have a power display there. And then you have got some of the oximeters have got a pulse rate bar graph. And behind the oximeter, you have a battery cover. You can put, mostly it is a AAA battery which is used. So these are the various parts, and you need to make sure that your index finger is inserted in a proper way. Just a part of it has to be inserted, and you have to wait for 10 to 20 seconds for the readings to be stable enough, and then you have to record and make sure that the recording is done properly and noted down. And if you are diagnosed COVID-19, then you have to make sure that the whole quarantine period is recorded, and the information is given to your doctor. Or otherwise also, you can definitely consider it whenever you feel shortness of breath or whenever you feel uneasiness. And in the description of the video, I have mentioned few links of Amazon where you can definitely procure the good pulse oximeters, and kindly look into the description of the video. Then it is, thank you so much.